cricothyroid membrane is the relatively avascular structure situated between the thyroid cartilage and the cricoid cartilage in the anterior part of the neck. The thyroid cartilage, or Adam's apple, is relatively easily palpated. Below it is the membrane, and below this is the cricoid cartilage. There are important vascular and anatomical structures in the anterior part of the neck, but using the cricothyroid membrane is a relatively safe approach to the trachea. If time allows, the anterior neck should be cleaned with an appropriate skin solution, and the area prepped as a sterile field. Surgical cricothyroidotomy can be achieved just using a simple scalpel, but tracheal hooks or tracheal dilators can be useful. Combined surgical and percutaneous kits are available. Identify the cricothyroid membrane and then fix structure of the neck with your non-dominant hand. Make a small vertical incision as shown here, followed by a stab through the cricothyroid membrane. The simple surgical technique then involves inserting the scalpel handle as shown here and rotating to open the cricothyroid membrane. A suitable cricothyroidotomy tube can then be inserted as shown. This should be held securely in place, where it can be connected to oxygen and ideally capnography. A slightly more advanced surgical technique involves the use of a tracheal hook and tracheal dilators. The incisions are made as previously, but this time we will use a tracheal hook which is inserted and then twisted cephalad in order to open up the cricothyroid membrane. Tracheal dilators can also be used, again to open up the hole and make insertion of the cricothyroidotomy tube a little easier.